Taking vital sign and blood pressure is important because it's a baseline data for anything.
Without consultation, there would be no diagnosis and there would actually be no medications to prescribe for treatment. Sometimes some of these patients are actually dealing with a lot, but they can't say it. It's funny enough, sometimes you will meet a patient that will tell you something that even his spouse or her spouse is not aware of. So having these medical consultations help us to know exactly what is wrong with the patient, and then we prescribe medications appropriately. I encountered a very interesting case today during the outreach. I saw a patient, and then after the consultation, I gave him some investigations to go and do, which included RBS, that's random blood sugar. And then by the time he came back with the results, I discovered that the RBS was pretty high. And then from family history, yes, he has a history of diabetes. So I just counseled him around it and wrote some medications for him. However, I told him after like 2 weeks, he should go to a proper facility and get evaluated. So immediately after I gave him the booklet to go and get his medications, he went to the medication stand, to the pharmaceutical stand, and then on his way back, he collapsed. He collapsed. I was sitting down and then I heard a lot of chaos going on, and I turned and I saw that it was the patient that I just finished seeing that collapsed. And then we rushed him, of course, we rushed him and then we stabilized him, discovered that the RBS had gone way high, and then even his BP had gone up and all that. So it was very interesting to me because I was just imagining, what if we had not come and then that man probably collapsed at home? That would have probably been the end of that man. But because Dreams Alive was around, and then immediately we saw him, we did a consultation, we're able to diagnose and know what was the issue.
The type of tests that are being conducted here today are hepatitis B, hepatitis C, fasting blood sugar, random blood sugar, urine analysis, that's urinalysis, H. pylori, malaria parasite test, so PT for pregnancy.
Most of our patients today were having the first experience for dental care. And at the end of the day, they were so happy. They kept saying, thank you, God bless you, and the rest of it. They did not know that they had the calculus, the level of dirt that we took out from their mouths during scaling and polishing. And others did not even know that the depth that they had, their curious lesions had gotten, they didn't know it was that bad. So they were really excited and happy.
We ensure that the beneficiaries will be able to take their medications properly by explaining how to take their medication in simple terms. Patients that do not understand English language, we explain it to them in the language they understand, Hausa or even their local dialect. We can get a translator that will translate and tell them how to take it properly. And then we also ask them questions to ensure that they understand how to take their medications. Today, there's a woman that came here with a prescription. She went to the hospital and she was diagnosed. She even came here with the prescription, but all this while, she was not able to get her medication. And this is a prescription of antihypertensives. And her BP was very high, but because of the cost implications, she could not get her medications. So coming here today, we were able to give her her medication. That is after consultation by our own doctors here on ground. We were able to give her her medication free of charge, and she was very happy.
Program in yayi kyau. Ba abun da zamu ce sai godiya kuma mun ji dadi.
Women are the backbone of every community. Their health and well-being shapes the future of generations to come. And that is why we are here today, to serve, to heal, and to uplift.